The sudden outbreak of COVID-19 has placed the whole world in a humanitarian crisis. We're all affected. As governments focus on the drastic measures needed to save lives, it is clear that for the time being, we have to live with the threat of COVID-19 in the communities in which we live and work. Unfortunately, COVID-19 is not the only threat to our society, and maintaining effective and compliant fire safety precautions is as critical now as it ever was. At Fixfire we have a motto, your best alliance for compliance, and we mean it. We provide life safety services day in and day out, 365 days a year, helping our customers stay compliant with fire safety regulations. At the same time, we care passionately about our workers. They are the lifeblood of the organisation, and nothing is more important to us than ensuring their safety and the safety of others they come into contact with during their work. It is not an option for us to turn our operations off whilst we wait for the COVID crisis to pass, but what we can and are doing is change the way in which we work. This is why, in recent days, we've been working hard to put in place policies and work procedures that uphold the government's safety guidelines. This short video will take you through some of those changes. As we've already said, fire safety is no less important now than it was before COVID struck. The regulatory reform Fire Safety Order 2005, often referred to simply as the RRO, remains unchanged, and the legal obligations on the responsible persons to maintain adequate and effective fire precautions stands. This statement has been published on our website and highlights the point. Consideration should be made to any changes that have been made to premises with regard to use and occupancy during the crisis, and fire risk assessments should be updated. We're able to help you with this if you need it. Insurers should also be informed, and our engineers are available to install automatic links from your fire alarm system to remote manned centres. Our doors are open and we can help you with any questions you may have. You can read this full statement and any updates that may be made to it on our website. We'll also maintain your systems on site during this period, but we need your cooperation to ensure the mutual safety of our employees and anyone that may be on site. We're following the government's advice very closely. While we're not at this point aware of any guidance that specifically relates to site visits made to maintain life safety equipment such as fire alarms, emergency lighting and fire extinguishers, etc., we are taking account of illustrative guidance that is being provided, for example, site operating procedures published by the Construction Leadership Council. There are a number of facets to our approach, and your attention is drawn to occupational risk assessments we've prepared that are available on our website. They contain a detailed analysis of hazards, risk factors and additional control measures that we're taking. The first strand of our approach is to protect the vulnerable. Anyone that can work from home is doing so. Anyone that is clinically extremely vulnerable will not undertake site visits of any form. The occupational risk assessments detail measures covering all categories of worker. The next point is clear communication. We've ensured that contact numbers and emergency contact details of all of our workers are up to date. We've circulated posters and we're monitoring and communicating messages as they come from the government. We may be separated from each other by distance, but communication is the key to staying together and staying informed. According to current Public Health England advice, the symptoms of COVID are a high temperature. This means you feel hot to your touch on your chest or back. They're saying that you do not need to measure your temperature. Or a new continuous cough. This means coughing for a lot more than an hour, or 3 or more coughing episodes in 24 hours. If you usually have a cough, it may be worse than usual. Attention is drawn to the 111 coronavirus service provided by the NHS, and anybody worried that they may have coronavirus is encouraged to use this service. If you have any of the symptoms, then isolate your household, stay at home, and follow NHS specialist medical advice. Next aspect concerns safe travel. We travel to site safely and carry out sanitary cleaning on our vehicles daily. All of our workers have their own transport and during the current crisis travel alone unless they are members of the same household. Before we make a site visit, we endeavour to obtain the latest COVID-19 information from the site we're visiting. We expect that a site will be able to demonstrate a practical understanding of the risks of the virus and have in place effective control measures. When we arrive at site, we'll make a further assessment. Work will only proceed where our workers deem it is safe to. If there are any concerns, we'll bring these to the attention of responsible persons on site. The backbone of the government's strategy to beat the virus is the practice of social distancing, which means keeping at least 2 metres apart from each other at all times, and work is planned to minimise contact between persons and avoid skin-to-skin and face-to-face contact. Where face-to-face contact is essential, we ensure this is kept to 15 minutes or less wherever possible. Our workers also maintain a safe distance, at least 2 metres, from anyone else as much as possible. Where it is not possible to remain 2 metres apart, we work side by side or facing away from each other rather than face to face if possible. Our service management system is PDA based and customers normally check work reports and sign them off on mobile devices. This represents a clear contact risk, and we're instead asking customers to allow us to sign on their behalf. We'll try and work in areas with good ventilation. On larger sites we work in teams, keeping the same people together and keeping the teams as small as possible. We're using stairs instead of lifts where possible. We're also taking practical steps to distance our workforce from each other, such as taking staggered breaks and having staggered start times. Where our workers are using machinery, we will ensure that it is cleaned down between uses. We're minimising contact with delivery drivers. Another key plank of the government strategy is the practice of good hygiene, in particular regular and thorough hand washing. Our workers are all equipped with hand sanitizer in case they're unable to access soap and water. We also practice wiping down surfaces and equipment we have come into contact with. The government is not currently advising the use of face masks outside of care sittings. Fixfire workers do not routinely use masks where 2 metre social distancing guidelines are met. They are, however, provided with masks where available to be used responsibly as a last resort after ensuring all of the measures previously outlined have been taken. We've cut down on the need for face-to-face meetings with the extensive use of video conferencing. Where meetings in person are required, we follow current guidelines to minimise the risk. We are empowering our workforce through training and support, entrusting them with the duty of assessing risks to their own safety or that of others whilst on site. Working together, we can limit the spread of infection, safeguard the vulnerable, and protect our staff and customers. At Fixfire, we care for each other and we care for our customers. We're doing everything we can to continue to be our customers' best alliance for compliance. Thank you everyone for the part you are playing in beating this global pandemic. We pay tribute to the health workers that are at the front line, putting their lives on the line every day to care for us all. At Fixfire, we carry out essential work to protect lives and property, and we thank everyone for their efforts in helping this critical work continue. Together, we will beat the virus. Stay safe, keep following government guidance, practice the 2-metre rule at all times, and wash your hands for 20 seconds regularly. Thank you.